So we'll search tomorrow in depth what is his problem. Oh, sorry. Is it okay?
Okay.
No? Good. So normally, if you like to palpate levator,
라베이트 palpation 보여드릴
a
것
good
같습니다.
strategy is to ask the person to lift the arm up to the ceiling. Lift the arm up.
자, 올려보세요.
And yeah, good. Stay. And you can see the muscle. It's here.
머슬이 보인답니다.
Can you see the muscle?
Yeah.
보여요? 펌핑된 머슬 보여요?
So it's a muscle that it's a little bit lateral because it starts from the upper cervical but likes to go to the scapula, to this region. So
스케플라 있죠. 슈페리얼
And
리전
of course you need
연결해서 보시면 보입니다. 예.
as far as you go for arm elevation, you need this downward rotation of the scapula. So you are activating the muscle. So I think it's a very nice strategy to palpate the muscle. So now I'm over the muscle. So I found it and I kept it like we did with the scalene muscles. And here I'm go transverse to find if there is a problem, pain over it's, and the whole muscle is like a taut band. You cannot distinguish taut bands within the muscle because it's narrow.
이게 좁아서 뭐
Trapezius is the muscle above, and I have with my nail tips touching the trapezius. So I'm below trapezius. I'm not over or into trapezius now. Today we touched also levator, but we have other things to do, and it's better to go when you have a specific purpose to go in a good technique for this muscle, to not mess it out with 20 muscles at that point. Can you see that it's jumping under my finger? Can you see the jumping?
점핑하고 있는 거 보입니다.
That's
볼록볼록.
levator.
이게 라베이트.
So it's also, you gain the feeling of a muscle. It's like a rope, but it's more angulated rope. It's not round.
라운드로
And yesterday we went also here, it's splenius capitis. But this is a thin muscle. It's totally different sensation. So
아주 얇은
visually
비하면.
are very close, but they have totally different feeling. So here you can go till the first vertebra, the transverse vertebra, because that's the origin. Normally here it's more tendinous, and the most of the pain is at the shoulder level and down. It's not that much on the upper. It's not that it doesn't happen, but it's not the most frequent. So is it painful here?
아파요 여기?
It's not the worst. So usually you need to work more. Can you lift the arm again? No, the arm. Not the shoulder. Arm up.
Extension.
Extended. Yeah, good. The most of the problem, you have it around here when it passes below on the trapezius, and you can treat, and it's a nice treatment technique, and you can do either a technique too. Here, although normally you must go across the fibers, sometimes I go perpendicular. That's my mania, to go perpendicular. I like to go sometimes perpendicular because it's a little bit more painful, but I'm sure that I'm on the taut band. I never lose the taut band.
Yeah.
Sometimes arm up. Good. I can use a technique and down and do it sometimes. Yeah.
The technique
I can use a 2B technique.
2B 테크닉입니다.
So I'm staying stable, do it. And he can do different movements. He can do like this. He can go below the back. He can go down. He can
여러 가지 동작을
here,
만들어낼 수 있겠죠. 이렇게.
here. He can do some movements for me. Okay? Now, sometimes I must go lower to the muscle, and remember that the muscle inserts to the medial border of the scapula. You must go over trapezius. It's not a clear below the skin palpation like before. So my palpation strategy here, it's easy. I have the scapula bone, and I'm palpating perpendicular around the bone till I find the taut fibers. It's very easy, it's very practical. However, it's not very easy to go with my fingers, so here I changed my strategy.
자, 다른 방법을 바꿔서 한번 보여드릴게요.
It's very tiring to be on back muscles with your fingers. So you palpate, you start always with the fingers, but then either you are using a wood or I'm using more the elbow. So when you are using the elbow, you must first palpate with the hand to have an orientation.
손가락으로 일단 오리엔테이션 하기
The
위해서
second,
먼저
it's
손가락
to
잡.
not use the point of the elbow. It's try to use more the flat surface of the elbow because this is really painful. And the third, it's never use the ulna on the person because you have the ulnar nerve and gets injured. You must always have a little bit external rotation to use the radial side. And I'm using the other for
너무 빼쪽한 걸로 하지 말고 평평한 걸로 하시고.
and it's not, I never had a problem. So here I will use this one to have this external rotation.
External.
And this is the taut fiber. And again, you can go transverse. If you like to be always on the taut fiber, you can go, it's crunch, 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 crunch. Pain?
아파요?
네, 네를.
조금 아프다. 리를.
Another thing to protect your ulnar nerve is to not do a lot of elbow flexion. Try to have a little bit loose elbow flexion angle.
자, 엘보 플렉션 해가지고.
So it's okay to do it for 5 minutes, but if you do it the whole day for some months, you will have a problem. Place, but when I go laterally, I'm losing the. So I'm using my other hand to stabilize my elbow. So I'm using these fingers to stop. Because I need a small movement and this is slippery. I'm losing the contact. So I'm guiding my left elbow by using the right fingers. I like very much to work with my elbows. So that's the techniques you can do. So the first is to bring the arm up and find the muscle. This is the muscle.
일단 찾으시고 머슬 이렇게.
And in some people, it's really easy to find. And when you don't have a lot of space under trapezius, you must go over trapezius. Now, sometimes you can do a technique 4. So here, normally you bring the arm up to release the upper trapezius because you shorten and make it soft. Below trapezius and trying to find the scapula.
Yeah.
And you are on levator. And as you stay here, you bring your arm to the side. So you are bringing the scapula to your hand. And
그다음에
it's like trying to detaching the levator to the trapezius. And it's like swimming. Technique we saw with trapezius, it's also helpful to pull the trapezius back compared to levator. So it's the technique we saw in the first day. Your fingertips must be medial towards the spine, not lateral, medial.
미디얼.
No, arm up. Good. Pain? The same. Yeah? Good. Lift your arms up. I think it's a different problem and we can discuss it tomorrow. The good thing is that he has a little bit more protrusion now in lifting up, so the scapula has a little bit